Provider partnership is a formal commitment across the statutory health and care organisations in Leeds. That's the NHS Trusts, Integrated Care Board and the Council, along with primary care partners and the voluntary community sector, to make sure that we are working better together in using all of our resources to prioritise the care and services we provide to the population of Leeds.
So we've known for a long time that we need to work together as organisations so that people don't see the boundaries between our organisations and people get the right help for them at the right time in the right place.
Success for me looks like feedback from the people in our communities at that neighbourhood level, that they are able to access local health and care services at the time that they need it. It's really simple to know where to go, that you get the support in response in a timely way, that there's only one point of access, you're not passed from pillar to post, and for our staff then that you're able to provide the support that people need without yourselves having to navigate multiple pathways, multiple criteria, multiple services.
For us as staff working in this system, I think it'll have a range of opportunities over time as this system builds itself to move around, to try different jobs, to work in different parts of the system, work in different parts of the NHS, come and work in the local authority. And I'd love it in the City Council if more people from the NHS were hopping over to work with us and vice versa. Because ultimately, we're all working for the same thing. It's for a healthy Leeds.
In order to provide that joined up seamless care, access to the same working spaces, the way that we use our estates differently at that neighbourhood level so that the local community can access it, but staff can work side by side. Easy to say but hard to do, but how do we get rid of some of those barriers in terms of our digital systems that we use, and really importantly building on the success of the Health and Care Academy, how do we have that joined up approach to development of the health and care workforce, from recruitment through to career development, and being able to work across organisational boundaries.
So we're just at the start of this journey now. We've decided we're going to create this provider partnership. This is just the start of the conversation, and I'd encourage every one of you watching this video, and thank you for doing so, to be part of this conversation and to keep a conversation going and to stay with us all together as we go on this journey. It's up to all of us to think, to have that sense of opportunity and sense of possibility, bring our ideas to the table. How can we take the barriers down between our organisations? How can we be as flexible as possible to the needs of our residents and meet them where they are? What would that look like? What would you like to bring to this system, to this new way of working between our organisations? What have we done in the past that has been brilliant that we should just do more of? And actually, honestly, what do we do at the minute that we should just stop because it's not serving our residents well? And what can we do to do less of the stuff that doesn't help and more of the stuff that does? That needs everyone to be a part of the system. Whatever job you've got in this system, you've got a role in helping this provider partnership, this new way of working, to come to life and to make the difference it could for our residents.